chest x-ray and how to present them during rounds, whether you're a medical student or you're a resident. Presenting a chest x-ray in a nice and thorough and systematic approach always looks good. So I follow the A, B, C, D, E format, which is kind of a format for people that like aren't radiologists, aren't very experienced, but want to present a chest x-ray and at least look like they know what they're doing. So the first thing you want to start off with is actually the name, the birth date, the date of the exam, and you also want to confirm the imaging modality and the view. So on this exam here, we can see that it's a PA chest. So you want to say that, and then you want to confirm that this is the correct patient and the correct date that you're looking for. And finally, you want to look at the rotation, inspiratory effort, and penetration. So rotation you can look at by looking at the clavicular heads, right here and here, and you want to look that they are equidistant from the spinous process. If the spinous process is deviated to the left or the right, you know the patient is rotated. If it's deviated to the right of the patient is rotated on their left, and then if it's deviated to the left, if it's closer to the left clavicular head, then the patient is rotated to their right. And that can, that gives you a different view. That'd be more of an oblique view if it is rotated. And then you want to look at the inspiratory effort, so you can either look at the anterior ribs, which are the ribs here that slope downward, or the posterior ribs, which slope outward. You'd like to see 10 posterior ribs or 8 anterior ribs to say that this is good inspiratory effort. Here you can see 1, 2, 3, 4, 5, 6, 7, 8, 9 anterior ribs, and then a lot of posterior ribs, so you know that this had good inspiratory effort. And then you want to look at penetration. Penetration is assessed by looking at the spine behind the cardiac silhouette. If the spine is not visible behind the cardiac silhouette, then the exam is underpenetrated, and likewise, if the lung fields are if there's just like way too much black, and you can't even see lung markings, then the exam is overpenetrated. Though that's just a bad exam, you might want to redo that chest X-ray. Next is the ABC, so that's airway, breathing, circulation, diaphragm and disability, and everything else. So airway, you want to make sure that the airway is midline. So here you can see the trachea is patent, and there's no obstructions going into the left and right mediastinum bronchi. Also, there's no narrowings here. There's no forked bodies, and the coronal angle is not widened. That could be a sign of pathology. Next would be breathing. You want to compare the upper segments to each other, the middle segments to each other, and the lower segments to each other. You're looking for any asymmetries or areas of increased density, which could be a consolidation or a mass. Here, these all look equal. The lung markings extend to the outer borders, even up here. No sign of pneumothorax or anything like that. And then you want to look at the lung vessels. So yeah, as I just said, that they extend to the outer borders, and there's no sign of pneumothorax or atelectasis. Then you want to look at the costophrenic angles here and make sure that they're sharp. Obviously, that is a sign of pleural effusion, and in this situation, they are sharp. After that, you'd like to look at the circulation. So you want to see if the cardiac silhouette is enlarged, greater than 50% of the mediastinum. And in this situation, the heart is not enlarged. The borders of the heart are clear, There's no silhouette sign. The aorta is not unfolded, and the mediastinum is central. It's not widened. And the hyla are, the hyla here are not calcified. There's no nodules in the hyla. The position and shape are normal. So then after that, you should look at the diaphragm as well as disability. So D is for disability and diaphragm. The right hemidiaphragm should be elevated higher than the left. That's actually normal. You want to look at that the diaphragmatic border is clear. You want to look at that the right hemidiaphragm is above the left. If the left is above the right, then that may be a sign of pathology like atelectasis. You want to make sure that there's no bone fractures. That's where the D in disability comes from. So any bone fractures, any visible bone fractures here, any soft tissue abnormalities out in here, not that I can see. And then E is for everything else. Are there any lines, tubes, or clips? Any subcutaneous emphysema, which you might see over here? There's none. So that's a basic, really quick rundown of a systematic approach. If you just memorize this list and have it in the back of your head when you're presenting the chest X-ray, then you'll at least impress your attending.
Thanks for watching. If you like the video, feel free to subscribe and like our videos. Thanks.